pitch and hearing your feedback as well. Is my volume okay? A thumbs up,
You
Katie?
sound great. You sound
Okay,
really
amazing.
great.
Okay, thank you. So I am the CEO and co-founder of Savyn. We are a digital trauma therapy platform using neuroscience. I really started solving this problem due to my lived experience. I am a survivor of war. I've experienced war firsthand, and I've lived with PTSD and have been in treatment. And this is a problem that we are trying to solve through Savyn. So I'm not alone in this facing this problem. 70% of adults will experience at least one traumatic event in their life, leading them to later on have PTSD, with 35% of those affected not getting access to care, leading them to have comorbidities such as anxiety, depression, substance abuse, suicide ideation, which is currently costing the Canadian government alone 56 billion in mental health burden. So the current gold standards to treat PTSD and trauma can be very labor intensive for the patient and expensive, costing upwards of $180 for a 45-minute to an hour session. So CBT is one of the most recognized trauma therapy protocols, what a lot of people think of as talk therapy. It has one of the longest times to see symptom reduction for trauma specifically, and has one of the highest dropout rates due to the labor that's required from the client, because it can be re-triggering. Exposure therapy is another treatment protocol. It has better adherence rate, but however, it can also be re-triggering for the client. Eye movement desensitization and reprocessing, or EMDR, is a treatment protocol that's based on neuroscience. There isn't a lot of talking. It works on the brain and rewiring the brain. It has been used successfully for 20 years in refugee camps. It's recommended still by the World Health Organization as the first line of treatment for trauma. However, it can be very expensive, and there isn't enough EMDR therapists available who are qualified to give this treatment. So what we have done to solve this really large problem, we've digitized EMDR and exposure therapy on our platform, reducing the time and cost for both patients and providers. So we do assessments on the patient, working together with providers, give them some grounding tools, and then we go into the eye movement treatment protocol. It's a little bit hard to talk about, so I am going to show you a demo on how our system works. So this is a 45-minute session that has been really sped up to a minute, and this is done by one of our team members. We have had patients use it, but not recorded it due to patient confidentiality. So here you will see that the client is going through some grounding techniques of deep breathing, which they have done in previous sessions. And I'm going to skip to the EMDR section. And once they finish, the protocol asks them to where they're feeling their trauma, think about the traumatic memory, where they're feeling it in their body. So it's a way of holistically healing what they're feeling in their body. And this healing happens really with this eye movement that you just showed. So that's where the magic happens, where the brain is able to, make, and through the eye movement as well, what happens is, traumatic memories or like things that have gotten forgotten or will come up, and there's an element of processing that happens, because a lot of the symptoms that have come up for non-treated trauma is because of the memories that have not been processed. So after 3 sets of this eye movement, we do close out with grounding, and we see how they're doing, and take data on their mood as well. And I'm going to go back to the presentation. Can everyone see the presentation? Yes, okay. So what we are reimagining is a trauma therapy for providers and patients that improve healthcare productivity with faster patient results and lower cost. And this has been validated by our clinical study at Sick Kids Research Institute in adults that were diagnosed with PTSD, who were in a really terrible motor vehicle accident. So with our study, we found we had 92% adherence rate, which meant the clients kept coming back to our platform week after week to do this. We had 59% symptom reduction of PTSD. We had 64% distress reduction and 43 and 41% of depression symptoms and anxiety symptoms. So the clinical efficacy is at 10%. We have far exceeded the clinical efficacy. And this was all done in just 8 weeks as compared to taking 12 to 18 weeks to see symptom reductions. So our value proposition and impact to our stakeholders who are public healthcare institutions, educational institutions, and insurance companies is that we are providing care at a lowered cost and faster patient results because we work in just 8 weeks with better patient outcomes with the symptom reduction. We are able to scale their services to meet the patients who are in wait lists because we are faster and reach 10 times more patients. And our downstream impacts to patients is they are getting access to treatment that is costed lower with discrete access because it's online. There's a lot of stigma around mental health, increasing their social productivity and integration back into society, and overall for the healthcare system, lowering costs. So looking at the competitive landscape, we are very uniquely positioned with high access to treatment, PTSD specifically treatment. And we are very focused on PTSD. We are not tackling any other types of symptoms with very high effectiveness as we've seen in our clinical study. So our business model is software. We are a SaaS platform. We are a B2B platform. We are licensing at $250 per user for an year. We have tiered pricing, and our B2B customers are healthcare institutions, first responders, refugee settlement agencies, and insurance with a revenue prediction of 10 million in 3 years. Our financial projections for now, right now we are in market. I'll show you our financial traction in a little bit, but starting with refugees and getting more contracts to 2 million. And then we also have clinics on pilots for clinics and first responders that we hope to start generating revenue by next year, and then tackle the insurance industry, leading to revenue that's over 10 million. So our financial traction so far, we have 1.63 million Canadian. We did a fundraising pre-seed round from Program Ventures. We are generating revenue right now. We have a contract with Service North Pine to service refugee agencies across Canada. That's worth 250. We have another contract under due diligence with USAID, and we've raised over close to 1 million in non-dilutive grants. Our traction, we've completed our clinical study and our publication is under review right now. We have onboarded 11 refugee agencies across Canada. We have a first responder pilot at St. Joseph's Hospital, and we have filed a patent for the US and Canada. So some of the partners we work with, we are also part of MIT, Sick Kids, and the Ontario Brain Institute. And we've got a fair amount of recognition for our social impact because we're working with refugees and other vulnerable organizations. And our team is cross-functional, cross-skilled. I'm the CEO and co-founder. I have experience with product and UX. Chris is our Chief Technology Officer. Jonah is our investor and really works with us as a fractional co-founder. And our advisors, Dr. Benjamin Dunkley, he's one of the leading neuroscientists in Ontario and across Canada. He's actually our PI who has helped us through our clinical study. And Dr. Don Naz and Gulin, they are EMDR consultants with over 15 years of experience. And they've really supported and helped us build our platform and co-design some aspects of it. We are doing a funding pre-seed raise, hoping to open it up by the end of the year. We are seeking to raise 1 million to reach a revenue of 5 million with within new markets. And most of it would go into scaling our technology and building more efficacies and AI. We are providing different languages on our platform as well, so to support all of that, and some of it going to the sales and the regulatory requirements that we have to tackle the new sales channels of insurance. We will hopefully down in 2 years, we want to be designated as software as a medical device class 2 so that we become a digital therapeutic. So this is the reason that we are raising. We are talking to quite a number of investors and have about 30% in soft commitment so far, and looking forward to working with others so that we can build a platform to heal people with trauma. Thank you.
Fantastic job. Just over 9 minutes. So you're in a really good time window. There's a little bit of space, a little bit of wiggle room, but really fantastic job, Sakeena. And the internet was great. So that was awesome.
I was so worried.
Yeah, yeah, it was awesome.
Like,
It worked really
please
well.
don't
Yeah.
stall on me.
Yeah, you sounded fantastic and the slides worked perfectly. So we're ready to dive into some feedback. This time, why don't we start? Oh, Alec went on mute. Okay, go ahead. I'm taking that as a sign you want to start with.
I thought you were going to pick me anyways.
Yeah, probably.
Yeah, I thought it was a very good presentation, very easy to follow. The story was really good, straightforward. Your pacing, the way you spoke was excellent. I thought the fact that you had a demo in there was fantastic. That's great. I'm gonna look that up on YouTube myself. So yeah, really, really great presentation. Obviously, I know nothing about the space. But yeah, you introduced yourself well. It all went really well. I think you talked about $250 per user per year. So I guess my question is, that's per end user, is that right?
Correct.
Yeah. And so how long does somebody use this? Like, you have an 8-week program. So is this something that you go back to every year, or is this kind of a one and done thing, or how does it work?
So usually it's 8 sessions. We bundle it up as 10 sessions, 8 sessions of EMDR, 2 sessions pre-sessions. So what happens when they're processing a specific traumatic memory, other memories come up as well. So they end up using maybe 20 sessions or 30 sessions. And it depends on the clinic and the support that they are providing. But we say it's unlimited sessions, so that usually where clinics also find it useful is when they are treating specifically a really high traumatic patient and they've been in-person, like have been in-person therapy, but now they need to be weaned off. They don't want to like completely let them go. So they use our platform as well as a support tool.
Okay, so you see an average user staying on the platform for how many years?
That's a tricky question. I haven't considered it. I think for the users, so far we've just been like providing it for 1 year, so I cannot predict it. But I think maybe a year or 2 years. It really depends on what is coming up for the patient and
Yeah,
the
and that's just some fuel for
memories.
thought. I'm just trying to assess, like, is it really recurring, or what kind of degree of recurring? And I'm not sure if the clinics are going to want to purchase on an open-ended, like, per user type basis, or is it maybe a number of seats that they have or something like that, so that they have a budget. But anyways, those are things you'll figure out eventually. But yeah, just saying 250 per user per year implies it's recurring. So which would be great if it is, but I wasn't sure if that was true. I think you also presented your funding, and that was 1.63 million. I think that was a mixture of funding as well as contracts.
Yeah.
So that was maybe presented a little bit strange. I would split out the contracts, and maybe I would give some more information about the contracts as well, because to me, that's one of the most important things, is the validation that you have people actually paying for your service. So more information on that. You mentioned there's a patent filed. maybe a little bit more color on that. Early stage investors tend to want to know a bit about that. In this case, it's a service. It's pretty straightforward. There's no hardware involved. So I'm curious what you could patent in that and how that's different. But how important that kind of moat is, I'm not sure exactly. Yeah, I think the $1 million raise, you mentioned that there's 30% stock commitment. That's great. Maybe a bit more information on the terms that you're looking at. Maybe you haven't decided on that yet, so you just want to say something verbally on that. The use of funds was shown, that was good. I'm curious as to how long that's going to last you, and it's going to take you to 5 million. So when is that going to happen? So maybe a little forecast of something would be nice. But in general, yeah, a very interesting presentation and really well done.
Thank you.
So I guess I'll go next. I guess I wanted to say first, I think Alec stole many of my thoughts. I think you wasted an opportunity by putting your contracts as your funding, because ultimately that's a traction slide, and I think that deserves its own slide. You have 2 contracts, and I think you need to talk more about them. And so I think that is not really considered by most people to be a source of funding. It's considered to be revenue. And revenue for a startup is really good. So you kind of de-emphasize that.
I think we might have lost Jim. We were worried about your internet, Sakeena, and it's Jim's.
Well, maybe I should
What's
go
the-
and then we can get back to Jim. Maybe
lost
Yeah.
me?
Yeah, we
Um,
lost
oh,
you,
I'm-
Jim. So
Oh,
maybe
you're
we'll.
back.
Oh,
Okay. Sure. Yeah, I'm in the car, and I knew you wanted advice. Can you hear me now?
yes.
So I guess the revenue model, I didn't like the revenue the way Alex said in terms of per year when you're. I think you need to look at your customers and understand how they get funded, and then you need to look at how you bill and link to how your customer gets funded. So if you're selling to a clinic, they're probably paid per clinic visit. So maybe it's amount per clinic dollars per each time it gets used. It's per person, but I think you have to read the link between how you bill. I guess again, before I fade out again.
Maybe you should turn off your video.
Yeah.
Jim, because you're breaking up.
I watching video and having the eye scans and everything.
Oh. Okay, Jim. I'm gonna send you, because I think you have a lot of good opinions here that you're sharing, and I'm trying to take the notes, but we're missing you. So I'm gonna resend the form, the feedback form. If maybe you could type out your feedback in the form, I could then get that to Sakeena after the workshop, or if your internet stabilizes, we'll take you back off of mute maybe in a couple of minutes. But until then, Maureen, maybe we'll ask you to just go ahead.
Okay. Nice pitch, Sakeena. Again, I thought it was a good tone and good cadence. I did like that. I had a few questions at the beginning when you're explaining the technology. I'm not sure what you meant by grounding. Maybe be a little more specific on that. And calling it magic, probably not a good idea. I would be a little more specific. How many patients were in your study? Again, maybe a little more specific on that. But it seems that you're beyond the study stages. You do have customers.
Correct.
But I was unclear, like you did say it takes about 8 sessions, and then later you said it's sort of up to 30 sessions. Is 8 an average, or how does that work? And that could feed into your pricing model a little better when you're clearer on how many sessions it takes for success with the product. Also, cost to the Canadian government of 56 billion. I presume that's in work lost, or because it's certainly not what they're spending on mental health care, specifically PTSD, but maybe a little bit more specific about that number if you're going to use it. And your jump from sort of an early stage to a $10 million revenue forecast in 3 years, I would like to see a lot more detail on that. Like, who are going to be those clients? How do you get to $3 million so quickly? And maybe what is your revenue now? Which part of your sales are revenue? It looked like a few $100,000, but you could provide more information there that gives you more support for that $3 million year 3 number. I mean, no, $10 million year 3 number. And then you wanted to move to a class 2 device in a couple of years. Maybe a little bit more information on the cost to move to that. And is that covered by your $1 million raise? I think that was about it. Good pitch.
Thank you. All great points. I'm taking it down to address them for sure.
Yeah, that was awesome. Lots of feedback. I don't know, Jim, if you're stable and you want it, and if there's anything else you have to add, that we have a couple more minutes.
I think what I'm trying to understand is whether it seems to be a kind of a video-based program that seems to run 45 minutes. If that's the case, are they watching the same thing each time, or is each session different? And I'm trying to understand more of the what. And I found as an investor, the what's confusing, what exactly you're doing for these people. I'm pretty thrilled with the efficacy data you presented, but I still don't know what you're actually doing. Did you hear that, Katie?
Yes, that was great.
Okay.
Yeah, that was really great. I'm just marking that down because I think that was a great point, building on what you had already said, speaking about revenue and emphasis. And so I took those notes too. So we got some earlier and we got this now. So that's fantastic. Okay, we have about 1 more minute. Sakeena, I don't know if there's anything else you want to say or ask.
Oh, I have one more question that I could ask. Does the practitioner have to be on the call for the full 45 minutes?
So we are recommending for the first 3 sessions, there is a moderation, and it doesn't have to be a practitioner. It can be a social worker, a master's student. And this is not one-on-one moderation. It is one-to-many. So they can class a group like up to 4 to 5 patients at one time and have them moderated. This is to ensure patient safety. Because you are working with trauma clients and ensure that like they're not getting triggered by the questions that are being asked, and thinking about the traumatic memory and the processing that happens.
It would be good to mention that it can be a group thing then, because if you've got one practitioner with 45 clients, each paying $45, or each, with billing of $250 per customer, it's a different revenue model.
Right. And this is only for the first 3 sessions. They do 8 sessions overall. So after the 3rd session, it's all self-directed.
Okay.
So yeah, that's a great point to emphasize, because I think it's more scalable that way, reach more patients quicker without being reliant on a practitioner in each session. That's a great point, Maureen. Okay. And that concludes our first pitch practice for Karina and Sakeena. You did a great job. Thank you so much, Alec, Jim, Maureen. This was fabulous. I've been taking notes, and the recordings are going to be made available. I'll get that to both of you and your coaches. I know some folks find it really painful to watch, but you did a really great job, and don't be too harsh on yourselves. But yeah, lots of learning to do, and we'll see you next week. We're really excited. So thank you all very much.
So much.
Well done.
Day.
Thank
Great
you.
stuff.
Good
Bye.
presentations. All right, bye.
Bye.